My name is Frank Steinfield. I'm with Casey Strategic Consulting Group, and I'm here today to present some of what I've learned about Hampton after spending almost 3 months visiting with them and getting to know this group. I also want to thank them publicly for being such great hosts. Again, Walt Creedle, Wanda Rogers, Denise Gallup, and Melanie Galloway. I'm very pleased that they're able to join us today. This all came about because when Casey began to support Virginia in its statewide reform efforts, they were reviewing CSA data and noticed a lot of very positive outcomes in Hampton, and particularly around reducing the usage of residential care and developing a lot of community-based services that seemed to be pretty effective. And they brought me in specifically to try to learn a little bit about what it was that they were doing down there, what were some of the specific action steps that they were taking, and how had culture evolved over time that enabled them to do this kind of work. So I went down over that period of time and interviewed 35 or 40 folks, sat in on FAPT meetings and CPMT and their stakeholders group, and really got a sense of how they're coordinated there and some of the efforts that they've made. The end point for my work is ultimately going to be a guide which attempts to capture the whole process as far as I could see that they've gone through over time, with the hope that other localities or jurisdictions, wherever, might be able to look at it and pull out pieces that seemed relevant to their own specific needs, that there was an opportunity to customize parts in other locations, and that was helpful. And Casey specifically thought, as it was aligned with the Foundation's beliefs, that this was an important place to go look at in some depth. So the structure of this presentation, which is really to set up a panel discussion, is going to be looking at the 5 areas that I divided the work into. And at the underlying theme was really looking at, well, what is CSA about? And although you can't really read this, I will. And I'm not going to read most of the quotations up here, but just to get us started, the purpose of the Act is to provide high-quality, child-centered, family-focused, cost-effective, community-based services to high-risk youth and their families. And this effort starts in the first area in changing practice and really starting to look at how those beliefs, that belief, can get translated into action. Yeah, thanks. And before I go into that first area, I had a couple of data slides that just reflected some of Hampton's work. This one is just sort of setting the stage, showing the ability of Hampton to serve children and families in a community-based setting, that 80 to 90% are able to do so. I think the fact that there's still the blue and whatever color at the top over there, which relates to the few folks in group homes, suggests that there's still work to do to try to be able to serve all children within their community, if possible. Next one. And this slide also a general look at how the locality is able to work with more challenging children within the community, and to be able to work with these high CAFIS scored kids. And as more and more children are being served in the community, it's becoming more important to be able to develop the services that can meet those kinds of demands. Moving on to the first section, and I promise I'll get to the panel very quickly. And just to, again, explain the process of this presentation, we're going to include some questions here in the presentation which the panel will address. And then at the end, I think, is the best time to open it up to a broader Q&A. I suppose if people have truly pressing questions, they can raise their hands, and the panel can choose to respond. So the first section, changing practice, again, looking at how those beliefs were translated into action. Again, Hampton has taken a bunch of different initiatives over a long period of time to be able to do this kind of work. At the top of it is really being able to communicate what's important across the whole organization. And Hampton has worked hard to do that over the years. Another key area, which I will discuss quite a bit, and I imagine the panel will as well, is the role of CSA and a FAP team, which in Hampton is located right in the middle of the department. It's a single team that's very focused and empowered and comes with a certain amount of specific rules that they've developed over time in terms of how they work with parents and families and the degree to which they engage them in real time and insist upon making decisions with them present in the meeting. And further, a lot of different instances of trying to develop the system around these practices. For instance, looking at benefits and services and thinking about ways in which the whole department can leverage CSA. The VIEW program, folks are getting trained to identify children with needs that could be met with CSA funds. And CSA children are occasionally, their families may be referred for benefits. So there's a lot of work that they're continuing to do in an area that's very important. Before we go to the panel, this was one of the quotations I did want to read because I thought it really captured the belief of the department, and it came from one of the social workers. You really have to believe within your heart that you're truly serving the children and families in your community. And if you don't do that, you're not going to be successful. And that message is relayed to us from the top. So even as line workers, when we're helping to train new workers, we're instilling that value in people right away. And I think when we really see the impact of what we're implementing, that it really does make a difference and it really works, it's addictive. So, in light of this statement and introduction, I'd like to turn to the panel now. I'm going to give them this mic. And we have some questions right here, which they've been looking at. And would like to ask, starting right off with placement decisions and how they're typically made in Hampton. Excuse me, folks. Wrong mic.
How are placement decisions typically made in Hampton? One child at a time. Everything that we do is centered around the child and family. It's not around programs. It's not around services. It's around needs of families. And so part of what Hampton has believed in and done for a long time is establish right away a core set of values and beliefs. And it's 8 core values that we work off at any given time. Keeping children and families together is the best possible use of resources. The CPMT and the FAP team will partner with all who can support children and families, successful outcomes. We begin with the outcome and not the process. We know right away what it is that we want to achieve for our young people and for our families, and we start there versus the other way around. We believe that families are experts about their families. We believe that all stakeholder groups are accountable for positive outcomes for children and their families at home, at school, and in the community. Child-centered, family-focused, and community-based service delivery is the law in Virginia and must be implemented through new practice models. We believe in doing whatever it takes to support the success of children and families. And last but certainly not least, we believe that trying hard is not good enough. And because of that, that has led us to where we are today.
And in the interest in working through this presentation and allowing some feedback from you folks, I'd like to turn to the question as to how people across the department learn about the Hampton's approach.
I serve as the DSS representative, and I take back all information that we receive from the FAP table to all of supervisors, lead workers. I have the pleasure of every Tuesday, I'm in a best practice agency, so I have access to all supervisors at all times and very flexible.
And so as you can see, part of what happens is the culture of the core values, our beliefs around children deserving to be in families, our belief that we do whatever it takes and trying hard good enough is given from these 2 individuals and then passed down and constantly reinforced through the FAP process, through the CPMT process, through any type of leadership meetings that may happen in the agencies, all the way down to child-specific meetings that may be held by social workers or other agencies.
I want to mention, as I look at this question, how do FAP members and DSS staff learn about Hampton's approach? It is not just DSS staff. In order for us to get to where we've got to include our healthy families, we've got to include our court service agency, the schools, and all of us coming together, and we try to make sure that everybody is on board and that we are constantly learning from one another.
And moving next to looking at what the more difficult elements were in getting people to change the way they worked. How did Hampton go about teaching people a new way to approach practice?
This is my favorite question because it was so difficult. I remember, and Keith Sykes is in the back of the room and was the chief of services at the time, and we had a meeting where Keith said something along the lines of, "We're moving west." And we were like, "And where are we going? And why do we have to move?" And all those kinds of questions came about. And so what that really meant was that CSA was the law now, and we were going to be doing business as it related to working with families and children in accordance with the child-centered, family-focused, community-based law. But you still had a set of social workers that, as we watched this team of people take up our valuable space in our office and, are claiming to be the experts about children, we were very resistant. We were in the halls daily saying, and who are they? And how do they think they know anything about what's going on with our children? And we're the ones who have to be in court, standing before the judge, and they're going to sit in there and they're going to make plans, and then we're going to have to try to justify those plans. So we fought all the time. And I think what ended up happening through that fight was that it was somewhat of a design to get the person who had the most fight or the person who had a passion around doing this kind of work to actually be the DSS rep on the FAP team. And so that person actually got a chance to fight with FAP on a regular basis. But as it turned out, as we began to present our cases in the FAP meetings, we began to see that the schools were just as interested in the cases as we were, that certainly the CSA coordinator was trying to hear from everybody, and right off the bat made statements like, we are going to have to come together. As the coordinator, I'm not anybody's supervisor, and so I need you all to understand that everybody's got equal power and everybody is going to be heard. But the bottom line is that we're going to come up with a plan for these children. And so with that kind of being the guidance and direction, it was very difficult not to buy into it. It was very easy serving as the DSS rep on the FAP team, which I had the pleasure of doing at that time, to share with my coworkers, one child at a time. As Denise talked about, we have really gotten a whole array of things that as a single DSS agency, we would not have been able to tap into. And so as we began to refer cases, as we began to bring children back home from residential treatment facilities, as we began to see that the FAP team members were up at 2 o'clock in the morning, the same as we were, and wanting to know what was going on with our children, our confidence that this was a system that could work began to evolve. And so now it is just an expectation that we will all come together around the needs of children, and we will all just do whatever it takes.
I think one of the other things that was a big factor early on in this process was shifting from what I would call placing children to creating placements. It was a huge jump to try and say, historically, people had been trained and their practice had been, the job really was to look at the needs of a child, go through your Rolodex on your desk and see if there were services in the community to meet those needs. And if they weren't, then you send the child off to an institutional placement. We started telling people if there is no service in the community or cluster of services that will meet the needs of this child, then our job is to create those services where they currently do not exist. that was a huge shift in the job expectation and in the thought process of our people and everybody around the FAP team table. I mean, every agency there was sort of operating in that same way, that if they would look in the community and if it's there, use it. If not, the recommendation is to put the child in residential or send the child off somewhere. So trying to, you know, I think the references earlier to tenacity and repetition and stay with it is just trying to convince people over and over again that when you don't see a service, you don't immediately jump to an out of the community placement. The focus needs to be on how do we work together as a FAP team and a CPMT with everybody at the table to create placements for children on an individualized basis. Really, the placement is really a system of care that's individualized for that child and that family, and they're all different. But it's our job to create that system of care for each individual child and family. That shift in thinking and shift in job expectation is probably one of the biggest changes that need to be made, and one of the most difficult and challenging things that I think people need to do.
Great. Anybody else on this subject? Okay. I guess I might take this too. Well, as all of the panelists have been mentioning, the role of the FAP and the CPMT team and the multiple agencies requires a large degree of successful partnering to be successful. The next section that we looked at in some depth was how does Hampton go about working with different groups, whether across the FAP table or throughout other agencies, with private providers, with the state, with the courts, and so forth. And many of the practices that they've looked at really have required and grown out of some of these partnerships. A few of the highlights up here on this slide include working with a very active juvenile and domestic relations court, which has acted frequently as a convener, bringing together a lot of these stakeholders and helping drive them towards being able to serve kids more readily in the community, whether kids are coming from social services or court services, that in order to avoid foster care or residential or detention, they have the capacity, or should, to take care of them, and really pushing them to think about creative ways to do so. Again, I've covered this issue around a system of care for each individual child. There is a lot of work really looking to match kids with specific providers and thinking about the sort of wraparound or support that's needed to be successful and to keep that child in the community. As Denise mentioned, the whole notion, and Ray as well, about focusing on outcomes and thinking about, well, what does it take to get there? And what are the pieces that we have and what's missing, and what will it take to fill in what's missing? And then, as also has been mentioned and will be continued to be mentioned, the importance of preventive services and having a fairly comprehensive and broadly understood sense that if you can provide services at the front end, you could reduce the need for less effective and more costly care on the back end, whether it's group homes or foster care or detention. So Hampton has done a lot of creative things, which I will let the panel address, to think about serving kids early on in the process. So moving right into our questions here. How did CSA build a relationship with judges?
I think that I'll describe that by saying having a certain degree of modesty and assertiveness with our judges. I can remember years and years ago, our director decided that she needed to send a message to our judges that they had the authority to give custody to the Hampton Department of Social Services, but that it was her job as the director to decide which placements were going to be made. And I went for years believing that the judge had put her in lockup because she was there advocating on our behalf. And I believe that's my story, and I'm sticking to it because I believe that there was a battle between the then director and the judge as it relates to what we were going to do about placing children. Once she said that to the judges, we had a degree of accountability. We needed to make sure that when we submitted court reports and when we submitted foster care service plans, that they were thorough and they were well prepared. Because if they were not, we knew that that was a chance that the judge would then say, I don't understand what it is you're trying to do to keep this community safe. This child is just going to need to go into a residential treatment facility. It was also our responsibility to explain to the judges how we felt about, where children do best, and to be able to demonstrate that what we were doing was not just cookie cutter, that it was basically a plan that the judge could understand around each individual child. And once we began to do that, and the judges began to feel that the decisions that were being made were sound decisions, we did not have issues with them giving custody and then ordering placement.
The next question just talks about how does Hampton move from the FAP table to creating services. One of the things that I think is really important for the group to understand is that, as you probably can get a feel, our leaders give us permission to make creative decisions around working with children and families. And I have coined it shared success and shared liability. So there's never one social worker or one probation officer or one mental health worker who feels that if I decide this type of service for this young person, if it hits the newspapers, if it's not successful, if whatever goes down, that I will be personally blamed. And that's really important when you begin to think about customizing services for young people. And so with that gives us an opportunity to have a different kind of thinking process. Think tank is what I call it. And so what happens is we are in the FAP meetings and we're staffing the cases, and there are several cases at any given point that we say, what in the world are we going to do about this young person or about this family? And that's what we do. We have a think tank meeting, and that means everybody at the table begins to process from both their individual agency perspective. Well, with the schools, I can do this for him in the school setting. And social services is saying, we may want to think about respite and how we can get a resource parent, which is a foster parent, to work with a birth parent in order to teach some skills that's successful. And then we have mental health who's saying, I'm going to get in there with the case management and link them to all of the mental health things they need. And then you got our course who's saying, well, the kid is on probation, so I'm going to watch this one a little closer. I'll go in and kind of serve as the representative for this kid. And so you begin to see people thinking about children and families in a different way. And we have our parent rep who's sitting at the table saying, we can't leave out the parent. We got to pull mama in. I know we think she has this, that, and that going on, but she's still the mom. And at the end of the day, that's who's going to work with this child. And so it becomes a whole different level of thinking about families because of the permission that has been given to do that. And so when you do that, you begin to think about success and what that means for an individual kid. And so I'm going to let Melanie talk because she could really talk about this, only because we're on the phone way after FAP hours. She's on the phone early in the morning, in the middle of the night, doing all kinds of stuff. But I wanted to give you an example of a service that kind of developed based on this. We have a group of young people who are in our system, not foster care, but our larger system, who we know during the summer they're going to bomb out of every single camp that there is in the world. If they bomb out of every single camp in the world, then we know parents can't go to work. We know that parents have to run and go pick them up. We know that usually they're in the streets, sometimes causing issues and problems for our city's finest, the Hampton Police Department. And so our goal was to figure out, how do we come up with something that will help these young people to be in a safe, supportive, therapeutic environment that would not kick them out. And so we began to sit at that table and think about our kids and think about their parents, and then begin to think about our providers who have really partnered with us to work specifically for individual children. And we said, well, they have this attitude of we never give up. So let's call them and say, hey, we need you to come up with this summer camp. And it has to be this therapeutic summer camp. Oh, and by the way, you can't kick anybody out. We don't care what they do. You have to figure out a way to work with them. And so we did that, and lo and behold, I think we were even super impressed. They came back to us with this camp that has just been incredible, so much so to our assistant director wants to go out and play with the children at the camp. They're all of our very high-end kids. CAFA scores are in zones that people would say these young people should be in residential treatment, and they're doing wonderfully, dancing and all kinds of fun things at this particular camp. So because of, once again, the permission that's allowed from the top to go ahead and be creative, not to be afraid that you may make a mistake, because you may. But when we do, what do we do next? Do we continue making the same mistake, or do we cut that off and start up with something else?
And I've been to there and to the Catch program. I've played with the children, and I do want to go back. And most of our workers have been there and are absolutely in love with it. As part of the FAP team, we're a very close-knit team. You see a lot of this with me and Denise. We have a relationship that I can call her, well, she can call me at 7 a.m., and we can have discussions. And at the FAP table, prime example, yesterday during our FAP meeting, we're having sidebar FAP meetings with individual children because we all know each other's children. So one that's in mental health really doesn't have anything to do with DSS, but I become involved because I want to help provide preventive services so they don't come into care. So I call them the red flag FAP children, per se, or however you want to call it, and we're constantly in contact. We know each other's cases. Our reps never change, hardly ever. We are the same representatives every Monday and Wednesday. We know each other inside and out. We eat lunch together. We, there's a lot of team building. So we know each other's cases, and then we can take them to our individual agencies and help troubleshoot. We're doing a lot right now because my position is ever changing as a transitional social worker and a DSS rep, is we're having an influx of relief of custodies. So as part of the FAP process, and me being the FAP DSS liaison, we're able to come together with our local CSB, and we're actually, and our court service unit, we're actually preventing children from coming into care, which is a new trend that's coming along. So it is all about our teamwork and and our close-knit relationship with our providers. The providers I use, and one example for me as a worker, I actually called a provider and said, I want this therapist for this specific family, or I don't want to use your company. And I got my therapist, and my family is successful when not in care. So I know my providers inside and out as well as we all do, and we're just selecting the right people. We're matching with the family, not just I need a therapist. I'm going to give you a therapist that's going to connect with you, and we'll have better outcomes.
Great, thank you. And the question as to how Hampton really got things going in the first place. Is that where you were going, Walt? Excellent.
I think to start with, we began, we'll go back in the early 90s. The city, fortunately, the culture within the city is a culture of collaboration. And I think it's important when you're trying to build a CPMT and a FAP team of people that can work together, it's extremely helpful to have an organization within the city or county government that already has a culture of collaboration. That was an important thing. Another thing with that culture of collaboration was consistent leadership. We've had people on the CPMT and on the FAP team that have been there for years. I've been there since the beginning. Chuck Hall, our CSB director, has been there since the beginning. We've got department heads and members of the FAP team that have been there for years, and that consistency of leadership in both of those teams is another important factor. And within a culture of collaboration, that builds the kind of teamwork that's needed. We early on made a decision that we didn't realize it at the time. In retrospect now, it seems like it was a really good decision, and that was to have a single FAP team. So we started off with a single FAP team, and we've stuck with that throughout the whole process. And with the consistent leadership and with the way people work in no cases, that has proved to be, we think, one of the most critical factors in trying to make a system like this work. In terms of actually getting started on turning the corner, so to speak, on the way we provide services, I'd say there were two things. There was the money question, and then there were the judges. Together, they created a crisis, and oftentimes to change the way you operate and the way you do business, I think requires a crisis. It's very difficult for people to go to a retreat and talk about how they ought to change and then go back and do it. Most people aren't going to do that. Most people, I think, change because they're in a crisis and they're frightened. They've got to do something different because they don't have a choice. In our situation, we had a city manager telling us that our spending was out of control, and over at the court, we had a judge telling us that we had a child in residential treatment at the time, I think, that had AIDS and was fond of cutting himself and throwing blood on people to try and infect other people, and a number of other behaviors that people didn't like to be around. The judge was saying, bring that child back to the community. And our coordinator sort of dragged his feet a little bit and was called back into court and said, where's the child? You need to bring that child back to the community. So on the one hand, we have a city manager saying you've got to get a grip on spending, and on the other hand, we've got a judge saying you've got to start bringing these kids back. For us, that was a crisis, and we had to respond to it. So getting started sometimes means having a crisis. Those two things were our crisis, and it forced us to look at this issue that I mentioned earlier. Maybe our job is not just to look in the community and see if there's a resource. Maybe our job is to create those resources, to create that system of care on a child-specific individual basis. So they're all different because they're all created in special situations. And so that really forced us to make that shift, which otherwise we may not have made.
Great. Thank you. Moving to the next section of research that we conducted, I looked more in depth at some of the specific services that Hampton has worked to create, how they collaborated with different partners, and what specific practices they put into place. So they've developed over time, as has been discussed already quite a bit, a whole portfolio of services that are based on individual needs. And again, when new programs have been required, largely it's been taking a lot of those individual needs and seeing that there's enough demand to create a program around it. Also, they've looked to wrap services around families and really thinking holistically about how to treat more challenging youth in the community. They've also looked to really find ways, as Walt just mentioned, to treat some of the hardest kids in the community that couldn't succeed in a group or residential setting, and have done so successfully. And some of these specific services have enabled them to do that. And the panel may speak to any of these in the next question section. So just thinking about working with providers and stepping back a little and looking at how Hampton goes about contracting. Who'd like to take that one?
I'll start with that one to follow up with what Walt just said. Contracting with providers became very difficult for us because as we had judges who now understood the whole idea of child-centered, family-focused, community-based services, who were saying to us as we would go back into court with the same plan that this child will remain at a residential treatment facility, and we've done a national search and we don't have anybody that is willing to take this particular child. We spent lots of late nights trying to figure out what we were going to do. And just to show you how serious we were about it and about understanding this particular child, the first thing the FAP team decided to do was design something that we called an intensive intervention specialist. Again, the social worker did not have the capacity to visit with this child every day, and we needed to know more about this child's behavior. But this intensive intervention specialist had the job of visiting with this child every single day, coming back and sharing with us what was going on with this child. Well, one particular day she came back and she said the most amazing thing just happened. I was visiting with him, and the counselor that works with him has the best relationship with him that I have ever seen. And so the CSA coordinator and some of the other FAP team members began to, you could see light bulbs going off. So what we decided to do was call this person that had this wonderful relationship with this child and talk with this person about what it was we were trying to do, that we believe that children deserve families, that we wanted to bring this child back to our community, that we wanted this person to be the foster parent for this child. And we weren't shy about it. You know, we said, you live in Norfolk and we don't want you to live in Norfolk. We want you to move to Hampton because if anything goes on with this child, we can't expect Norfolk to be the one who will respond late at night. So we need you to give up your entire life and come to Hampton and work with us. And because this guy really saw some merit in what we were talking about, he was willing to give it a try. He gave it a try just based on us sitting down with a napkin and saying, you know, and this is what we think it is going to cost to start this up, and this is what we think we're going to pay each month for this child. And we want you to just do this. We'll find the house, we'll look for some furniture, but this is not a group home concept. This is your child, and once you get this child, you're going to do everything that a father would do for this child, and you can never ever call us and say, come get this child. And so it is amazing that we were able to set it up that way. But this guy said to us later that there was one thing that we said to him, and that was that we're making this up as we go, but we've got your back, and anything that goes on, we're going to be there for you. And certainly we have always been there for him. So he started this home. He took this child in 1997. And he is still going strong, and we have created some additional families as he needed support with the children in his home. The support staff, after they became familiar with what it took to take care of children with this acuity level, decided they were ready, and they branched out to be able to do what we now term as the specialized intensive foster care program, and that simply means that children who would otherwise be in residential treatment facilities are able to be in our community with huge support, but in the community nonetheless. And so there are lots of stories like that, and I'm sure Denise is ready to tell a few more. But that's how we kind of contract.
So as you can see, we don't have any shame about going after whatever it is and whoever it takes to make for success in the life of a child. Success meaning permanency, family connections, and relationship in their own communities. And so we don't have a problem doing that. And because of that, that kind of brings me back to contracting with providers. We have all types of providers that we enter into contractual relationships with. We have the larger agencies that do intensive in-home services and some of the other kinds of services, and we do formalized contracts with them that have been approved and signed off by our city attorney and things of that nature. But we also do child-specific contracts. So because we really believe that the family drives the process. And if you allow them to drive the process, what you'll find is that they really do have lots of resources that you can tap into that makes perfect sense to keep this young person in the community and most of the time out of the foster care system. And I say most of the time because since I have been there, Hampton Department of Social Services have worked very aggressively to reunify children with their own families, to connect them to families, to push for adoption. And I know when I got there, I think the foster care census was at like 268 or something of that nature. Is down to like 130 kids in foster care. Well, what does that mean for CSA, who's still serving almost 500 kids? It means that there are still about 350 kids that at any given point, if we don't really look at, that they could end up back in the foster care system. And so we began to think about that, and we began to think about who the players should be, and then contract with folk individually to include families. Family members being supports and resources for their own children. And when I first got to Hampton, I just thought that was the most creative, best thing I'd ever heard, ever. It was a program, if you want to call it that. We don't use the word program because we don't believe in programs. We believe in systems of care for each individual child. But what happened was, based on the work that was done with one child, we figured out, this might work with 35 more. Or this may work with the next 100 or whatever. Well, the teaching parent program, I always like to hear Wanda tell a story, but she didn't, so I will. That this whole idea came out of the fact that it was a young person who really had a lot of problems in the school system. Not in any other place in the community, but mostly in school. The child ended up having to go to residential treatment because the school system had not quite figured out how to work with this young person in the schools. But what quickly Mr. Credo told the worker from the FAP team who was going up with the child to residential is the minute you get there, you start talking about discharge. And so that person began to do that. And so what happened was it made Hampton really begin to talk to parents in a whole different way, because what they found out was that the young person didn't have any problems at home, autistic and some other mental health kinds of things going on, but the parents were able to manage this young man in the home environment. And so they began to ask questions. Well, Mom, what kinds of stuff are you doing, and how does that work? And it sounds like those are very good ideas, and maybe some of what you're doing at home could be done in the schools. Well, the schools didn't necessarily have the resources to do the kinds of things that Mom was doing with this young person at home. And so Hampton made a conscious decision at that point, who would be the very best provider to work with this child in the school system to keep him from being IEP'd to a residential facility that at the time there was no Medicaid that paid for that. Who would be the very best person to do that? Well, it happened to be Mom. Mom was working, and she was working a $7 an hour job, and she said, I got to work. I can't take care of the rest of my kids if I don't work. And so we said, hey, want to work for us? And she said, sure. And so Mom became the one-to-one support for her own child in the school system. And so that just took off like wildfire, because then Mom, once everything started working out well for the kids, I think the kids spent 20 days in residential treatment, 20 days. Shortest ever that we've ever had, even since I've been there, 20 days. And so, but what happened, Mom got tired. Okay, I love my kid, but I'm tired of seeing them in school and then turn around and seeing them at home. I need some help. And so what Hampton did again was say, well, you really are the expert on this stuff. We hear you talk about it, and it clearly is working. We can tell by the success of the kid. So then we're going to let you teach the next provider who is to work with this young person in the school system. And that's what happened. And so out of that, voila, the teaching parent program was formed. And so it's just things of that nature. Individually, working with kids, working with their families, listening to families, allowing families to guide us about the children that they know way better than anybody in this room will ever know. And based on that, doing that. One of the other things I wanted to talk about is our Community Services Board. Now, our CSB may be a little different than other people's. They are certainly one of our community partners. They sit on the FAP team. They share all of our beliefs and ideas. But the other advantage that we have about our CSB is they provide lots of services. I mean, globs of community-based mental health types of services. And because of that, when we're sitting around brainstorming about what could be helpful for this particular child, our CSB is also sitting around brainstorming. And they say, hey, we could do that. And I said, you can do that? And they said, we can do that. I said, can you bill Medicaid for it? They said, yeah. I said, yeah. And so because of that, we have lots and lots of services that our Community Services Board is always involved in, connected with. I think the biggest one that you all probably have heard about is the intensive care coordination. We call it clinical care coordination or clinical case management or whatever you want to call it. But that is one of the most valuable services that you can't bill Medicaid for, by the way. But it is one of the most valuable services that I think our Community Services Board has provided to us because of the fact that social workers, probation officers, special education folk don't have the time to go into residential facilities every day if needed to harass them around the plans for our kids. But guess who does? The CSB. And they do it well because they have all of the titles that doctors and psychiatrists tend to appreciate, like the LCSWs and the LPCs and the PsyDs and all of that stuff. And so it just has really helped us to have a broad spectrum of services in our toolkit. As new cases come up, we can think of how that helped for this case, and maybe it'll help for the next one. May, you want to say anything?
Actually, I can go on to the next question.
What's the next
if that's okay.
Very good.
Because they've answered it. How does Hampton determine if services are effective? Well, I kind of jumped the gun and told you that earlier. As a DSS worker, and where I work, I have the ability to say, no, not working, we need plan B. I don't wait. I can go into Ms. Rogers or Denise at any time. All of us can as workers. You don't have that everywhere. We have the relationship. We are all bought into the philosophy. We all believe that children do better in their homes. And we've been successful at that. One way of how I determine is when I go meet with families and do family group conferences in their home, and whenever that is, if it's I'm going this Sunday night at 8 p.m. to visit a family, and I said to them, what are we going to do as a family to do this? I don't say, I'm Miss Susie, social worker, and you have to A, B, and C. I say, what do you want to do as a family? And then when they say, well, what about school? I got you. Well, what about after school? I got you. Well, what about respite? I have an answer for, I'm prepared because I know what I'm able to provide, whatever it takes. Then I go back and negotiate. Well, I met with this family. What do you think? How can we implement this? And this is where the creativity comes in. I'm able to be creative, and I go to my leaders with solutions. Now, they tweak it and will tune it for me, because I am one of the line workers, but I'm going to them, and they've given me that ability to do that, and that's part of the reason why we're so successful.
This was just a quick additional data point about serving juvenile justice youth and the ability to do so, improving over time. As we've already begun to talk about a bit already, the ability to leverage flexible funding and to use the pooled funding that CSA makes available, and to also use partners' access to different funding streams has been critical in coming up with creative ways to serve children and families. So, as mentioned, Hampton is very thorough and disciplined about pursuing alternative funding streams and having the CPMT provide oversight to that on a regular basis. And again, thinking about prevention throughout and trying to find ways to serve children and families before the need grows for higher levels of care. So looking at funding, how does Hampton maximize its alternative funding streams?
One of the things that we look at every CPMT meeting, we basically only look at a couple of things in tracking this program. We look at the overall expenditure trends. We look at how many kids are in high-cost residential placements. and we look at alternate funding. Those are the three things we look at. We don't look at 10 or 15 or 20 things. We look at three things. And Frank is handing out now the alternate funding list. I think you'll see on there that the alternate funding sources that we use so that we don't have to use funds pool. And I think our funds pool is running about $7 million a year, and I think the alternate funding is, what, 7.5 or 8 or something like that. So the alternate funding sources are picking up the larger part now of the services that we provide through CSA. And this is something that I think Denise and others have done a good job with. But in terms of dealing with some of the funding issues in CSA, if you look at that chart, we look at that at every single meeting. At every meeting we look at that chart, along with the overall expenditure trends for the funds pool and how many kids are in high-cost placements. And if those things are in the right range, then we're satisfied, CPMC is satisfied, that things are moving in the right direction. If one of those three indicators that I mentioned gets out of whack, then we have to stop and take note and look at where things, and maybe have another meeting and talk about what are we going to do. But I can't overemphasize the importance of the CPMT every month looking at those things. Kids in high-cost placements, individual kids in high-cost placements, because Denise goes through those at every meeting. It's a utilization review process, talks about every one of those kids and what's their discharge date, how well they're doing, are they making progress, and that sort of thing. And then this chart of alternate funding, so that the CPMT is constantly dealing with that information every single month.
And so I think what we've realized lately is that as we have tried to keep our children in the community, we've been able to achieve 0 children in residential for over a year now, and there is only 1 child in a group home. But as Denise often shares at CPMT, that doesn't necessarily mean that our spending is way down, because it does cost to keep children in the community. But what we feel that we have done is to reinvest in the child. Instead of having that child in a residential treatment facility that is not going to offer permanence, we have now brought that child back to the community, placed that child with a family that will offer permanence. And so we are monitoring what that costs, in terms of how we're having to meet the educational needs of that child, how we're having to provide services, wraparound services to the families that are keeping those children. So looking at that report every month gives us clear indicators as to how we're doing and really how much it's costing. And certainly we are encouraged that we are always trying to look for ways to get the best match, as far as the city is concerned. And so now certainly community-based services, our city is applauding, because it means that the best match rate, is attached to those children who are back in our community. So we are daily trying to figure out how to get it right for the children that we have back in our community. And it is a struggle at times, but we are committed to keeping them there, and we are committed to developing whatever services we need to develop to support them.
Part of, I think, what makes Hampton unique is that as the CSA coordinator, I have the opportunity to manage or oversee all of the alternative funding streams that flow into Hampton as it relates to children and families. And what that does is, it does a couple of things. The first thing is that I really need to be knowledgeable about the different pots of money. What are the criteria that are around those pots? How do you access it? What can you access those pots of money for? And even for funds that I call diversion funds that I don't necessarily manage or oversee, our agencies are providing reports on a monthly basis. Our partner agencies provide me a report every month to say, this is what we spent with this dollar amount out of this fund, that if we had not had it, then it certainly would have been a CSA expense. And so because of that, that's a pretty savvy level person that is capable of managing multiple streams of funds and being able to know when is it time to move kids from one pot to the next. And so I think the Department of Human Services has done a really good job in setting up specific positions to ensure that we capitalize on funding the way that we should. For instance, we have a social worker or eligibility worker, whatever you want to call it. I call her Title IV specialist, who immediately upon a child entering the foster care system makes the determination as soon as possible to see whether or not this young person is eligible for Title IV, Title IV funds. If for whatever reason the young person is, she immediately sends an email and a memo to the CSA office to say that this young person meets the criteria for 4E, and then we immediately shift them from the CSA pool to the 4E pool. And so it's just things like that that have developed over the course of time that has been helpful for Hampton as far as utilizing alternative funds.
Thank you. And moving on to the final section, which is looking at the administration accountability that Hampton's developed. This is really looking at the structure that's evolved to help manage the changing practice, the partnerships, and the development of the services. So some of these areas have already been touched on. One that relates to the funding is really Hampton uses a budgeting process, even though many of these services are sum sufficient, as a way to really impart some discipline on the proceedings and to give some awareness as to whether or not spending is really exceeding expectations. Again, Hampton tries to be proactive in terms of working with statewide organizations and really trying to understand what might be coming down the pike in the future, what are the trends, what's going to emerge that could be a surprise to how they do business. And again, getting back to practice once again in the relationship with the different stakeholders that are at the FAP table and that are across the locality. One of the practices that hasn't been mentioned, which came out of the work with the court, is the Pathway to Permanency tool, which is really required of all reunification cases in Hampton, and which really maps out an approach for a family to take that's coming into the system and helps them to organize around all the different issues that they need to attend to if they want to be reunified. And it also helps them locate the services and access the resources that are needed to do that. Oh, and at the very bottom, sorry, was promote from within. Again, there are people at Hampton, like Ms. Rogers, who've been there for some time and have seen a lot of the different aspects of the organization and have been able to share their experience with others who are rising through the ranks or coming in and trying to learn about the culture and the approach. One of the areas they haven't been successful in finding internal candidates has really been CSA coordinator, which tends to be a job that just requires a certain background and training, which has required going outside of the normal hiring areas and frequently into the private sector or beyond to find people that have those skills to do the kinds of things that somebody like Denise or other coordinators around the state have to do, tending with all the practice issues, the finance issues, the organizational issues. Moving on to a quick discussion, and then we'll, I hope, have time for a quick few questions from the audience. How does Hampton manage both quality and cost of care?
Frank, let me just comment briefly on the promotion from within thing that you mentioned. It's true that not only the Social Service and Human Service Department, but the agencies around the FAP table and around the CPMT have tended to bring experienced people to the table, and so every agency is conscious of trying to do that. But the CSA coordinator position somehow is different. We've only had one CSA coordinator that did not come from the private sector. We've had, I forget how many coordinators over the years. We've had 5. One that came from a public agency and it didn't work out, and there are other ones that have come from the private sector. That's not to say that the private sector just automatically provides better candidates. I don't want to give that impression. But we have found that, I don't know if I ought to give away a secret or not. Well, one of the things that you can do with the FAP team is use the FAP team as a way to assess the people coming to the table and to their leadership ability, their clinical skills, their collaborative skills, their ability to facilitate a team process rather than be disruptive in a team process. You can use the FAP meetings to assess for employment purposes. We've mentioned that in the other areas as well, but the coordinators that we've hired have been from the private sector, and they've been people that we learned about through the FAP process. So we knew what we were getting or dealing with or looking for when we saw those people. So that's a resource. That's a different way to use the FAP team as a resource. If you've got a vacancy or anticipate a vacancy as your CSA coordinator, look at who's already providing services for you. And there's probably somebody in that group that would make a good CSA coordinator.
Managing both the quality and the cost of care, our FAP team does a fantastic job of doing that. We staff cases. All of the cases that we staff at least quarterly are high-end cases, whether that's residential treatment, group homes, or kids that we call our red flag kids. All of them really could be, but then there's a certain subgroup that at any given moment they could end up in a more restrictive placement, whether that's residential treatment, acute care, or juvenile detention. And those young people we staff more often, usually every 30 days. That's the formal FAP team process. But in addition to that, like I said before, we have our clinical case managers who are going out to facilities, to families' homes, at least on a weekly, sometimes twice a week basis, just to ensure that things are going well. We have very diligent social workers and senior workers who are contacting families to talk about whether or not the services are working, and what does that mean. And when they're not, we are quick to say, okay, we have to shift. We're not going to do more of the same. We're not, as Mr. Creedle says, we're not going to throw good money after bad. We're going to stop this, and we're going to start something different. And so that has helped us to really be able to manage both things, I think, probably at the same time. And so as far as the next question, which Wanda and I laughed when we saw the question because at first we didn't know what it meant. And it was, how does Hampton use information technology to manage data? We said, we got to call Frank and see what is it that he's looking for here. And so once he explained it to us, I like this story too. I think this is a pretty cool story. Is a time when we were looking to try to apply for a systems of care grant through SAMHSA and through the University of South Florida, and they asked a series of questions about the work, the practice work. They also asked for data, to really show that what you were talking about truly was happening. And so Wanda and I, we sat down to answer the questions, and we got all hyped. I mean, we were excited, and Wanda kept saying, we really do this stuff. We do this. So we were very happy about that. But what we also found is that we didn't have any data. We just had, we had what we believed to be success. Now, the one thing people, CSA coordinators are not necessarily fond of the data set. Usually we're not very fond of that, but not to get rid of it, right? But we just wanted to say that. But it really has been helpful for Hampton because we may not have ever captured that stuff if we were not pushed by the state to do it. And so that's where we began to look. And we said, oh, wow, okay, so there is at least a little bit of something that the state is reporting based on what we're giving them about us. But we figure that we better start looking at our own self a little closer, and that's what we did. So we've developed several things at this point. We have a I don't know what you call it, a report that came out that talked about the sustainability of our specialized intensive program. We are in the process of collecting more specific data around homeschooling community for our young people at the FAP table. And then, of course, Casey came in, and they really focus on data. And so they took a look at some of our CAFA scores and some other things, permanency stuff, and how many kids are in foster care and how many are not, and things like that really helped us to get a handle on that. So that's one piece that we certainly recognize that we have to do a better job, partly because we can get so caught up every day in just the work and the families. We love to do that. So Wanda and I sit around all day and all night talking about what we should do for a kid or for a family. But we don't sit around all day, all night talking about how you put it down on paper. So I think this entire process I know it certainly has been helpful for the two of us. And so we appreciate you all coming in, Casey, to kind of force us to really take a closer look and have some stuff on paper that we can then share.
And just to interject for a second, I think that Hampton does a great job looking at financial data and being able to track spending and needs and so forth. But beginning to look at more permanency type data and outcome data over time, I think is something that most localities are working on in the state as well, to really look at the bigger picture in terms of are we getting the results that we want to get for kids, and can we follow them after the year end and after services have been completed.
And so we've learned to look at OASIS, and we've learned to clean up OASIS so that we could use the data that's there. And so now what we're doing is looking at our foster care numbers as it relates to children aging out of foster care. And so because we know our data is clean, we know that we have 72 children who are between the ages of 14 and 21. And so we bring this to our ATM meetings, that's the administrative team, and we say, so what is Hampton going to do to make sure that these children do not age out of foster care without a plan? And so we decide to do development teams that will focus on that particular topic. And because that's become a way we operate, we now have this before our entire stakeholders group. The development team is focusing on first the children that are 16 to 21, and then even greater focus on the 18 to 21-year-olds and the judges at the table. And so we're looking at how we're going to discharge them from foster care to employment, to higher education or enlistment. And we try to keep those three things on the forefront. But our data caused us to be able to look at where we really need to focus our energy. So we are getting there, but we still have a little ways to go.
Great. I think I'd like to open up to a couple of quick questions if we have time. Just to put up the last slide. I was going to read these out loud, but you guys all have them, so I'm going to go right in to first question. In the back?
I think it's the question is more, how did department heads, when faced with a crisis, decide to give up some of their authority and delegate to the staff to solve the problem. I think that it started with the fact that we were committed at the front end to a single FAP team, and we delegated at the beginning to that FAP team before the crisis hit. We had delegated to that FAP team the authority to make all the decisions on the cases. At the CPMT level, we basically looked at those three indicators that I mentioned earlier. We tracked overall spending, we looked at the alternate funding sources, and we looked at the number of kids that are in high-cost residential placements. We looked at those at every meeting. But if those things seemed to be trending in the right direction, we didn't get involved too much with the FAP team. It was they were doing their work. They were doing their work. So when we got into this crisis where we really had to deal with the funding issue, we did hold some meetings with the FAP team to try to impress upon them the importance of dealing with these issues. And we did ask members of the CPMT to take some responsibility for actually looking at those high-cost placements that we had individually and trying to begin doing something about it, which meant they had to work with their FAP team members. But basically, the CPMT didn't try to micromanage the FAP team. We tried to take the position that we were at a policy and leadership role, and that the FAP team, as long as they were working in the right direction on those issues, that they needed to have as much independence, not independence, but I guess permission was the term that you used earlier, permission to try new and different things. Does that get at your question, Keith? Yeah.
The question, I believe, is, the first part of the question is, were you, Hampton, able to decrease your CSA spending because of the use of community-based services? And then the second piece is around the alternative funding. And I believe the question is, did those alternative pots of funding increase? And then he asked a question about the local share. That's and it went right. Well, that'd be real nice. But it went on to say whether or not there is a local decrease based on the use of all of these pools. The first thing I wanted to talk about is what he said is the idea of the cost of CSA going down. There, I think, is the philosophical question on the table. And the question is it the intention of a locality or a state to save as much money as possible, or is it the intention to do what we believe is best for children and families? For a long time in the city of Hampton, they looked the same, partly because the CSA pool fund was used for all high-cost residential treatment facilities and other high-cost placements. In 2000, Medicaid began to pay for a big chunk of residential treatment services, therapeutic foster care services, so those things that are extremely costly for local governments through its use of CSA. And so what that did or could easily do in some localities, if you're not careful, is, well, what's the cost savings? You know, at one time it made a whole lot of sense to pull children out of residential treatment to save money when all of the money was coming out of CSA. But now, if Medicaid is going to match and our local Medicaid percentage is less than our local CSA percentage, what do you do? And I think it goes back to core values. It goes back to, what do you really believe is best for children and families, based on what you see every day and based on what happens at the end of the day. And that means when kids age out of our system and they are now adults in your system. What happens for these young people? What are the outcomes? And so for a long time, Hampton maintained around a $4 million budget for years. You know, and probably was really applauded around the state and everywhere else as it related to how much costs were saved because of its philosophies. When Medicaid began to do this work, and we also realized that the acuity level of young people in our communities appeared to be going up. I'm sure that's happening everywhere else. What you figure was, in order to work with them and to keep young people in their homes, in their communities, that you may have some kids and families that require a high dosage or a high level of service, which costs money. And so because of that, our expenditures in Hampton have increased. Now, what we've also found is that initially, when the first kind of CSA coordinator that was tasked to pull young people out of residential treatment and work with them in the community, that their expenditures also increased. And then over time, 2 or 3 years, you begin to see a leveling off of that. And that's kind of what has happened with us. As we took on a focus that we believe that every child deserved to be in their own families or in a family-like setting, and begin to really look at residential treatment and to also look at group homes, independent living programs where young people went to live outside of their families, and that the young people's acuity level was still great. we began to really focus on the fact that what is it that we can do to keep kids in their communities, in their families' home, out of the foster care system. And so that has caused an increase in our expenditures through CSA. But what we've seen now for the last 2 years is that it's beginning to level off. And so that's been our history. As far as the alternative funding sources are concerned, they are absolutely going up. As we are doing business, as we are getting high special needs young people adopted, as we are really aggressively moving to get children in the right categories, then those increases are also happening.
Dean, I think that clearly the expenditures are not going down and haven't gone down really at any point in this process. We've had years and years when it's been level, but it's gone up and it's starting to level off again. But I think the key point here is if you compare the increases in Hampton with the statewide increase in CSA, just talking about the funds pool, not the other alternative thing, just the funds pool, the Hampton increase has been less. It's not been no increase. It's just been less increase than the overall state has been. So does that answer your question? Yeah.
I think his voice was strong enough that everybody heard the question. Did you hear the question about, the services and I'm going to say the consistency in people who are around the table, who initially bought into the philosophy that we wanted our children in the community, and then the providers being at the FAP table who were also hearing that kind of desire from the FAP team members. I think it has across the board been consistent. I think that you will find that as new staff come on board, you have enough of the seasoned staff that the philosophy continues to be carried, and that we spend a lot of time trying to come together as focus groups, as, doing surveys to make sure that everybody is on board with what we're doing. Is it working? And so as we're talking about all of those things and the involvement that we want from the community at large, you continue to pass that information on to everybody who is going to be involved. We have had meetings from time to time where we've said to our providers, this is what we would like to do. And you may not decide to work with us, in the upcoming year by what we've just said to this group. Some of you may decide this is not what my agency wants to do, so I am no longer going to be on your vendor list. And that does happen. But the people who remain are committed to families and children, are committed to keeping the children in the community. And even as the judges have changed, when we got additional judges, because of the senior status of the chief judge at that time being able to pass that information on, we still were able to operate with the court actually signing on as a best practice court and taking a leadership role in many of the things that we do. They were willing to change the way they did some things, and we certainly changed the way we did things. But we continue to have open dialogue, and we do it as regularly as we need to ensure that the word is out as to what it is we're trying to accomplish.
Thanks. I think time for one last question.
Can you share more with us about your Pathways to Permanency tool?
Yes. The Pathway to Permanency tool really is a collaborative effort between the court and the Department of Social Services. What happened with that, we were looking to achieve permanence for children in shorter time periods. And as we began to talk about what was going on, the judge made some comments that oftentimes we would ask for a continuance because people just hadn't gotten around to doing things. And so we decided to look at all the things that people were not getting around to and develop a structure that would allow us to get around to those things in a timely manner. So this binder is really for the parent, and it helps the parent to keep track of everything that they have agreed to do as we've developed the foster care service plan with them. And it ensures that they are going to have regular visitation, because one of the things the judge commented about is that the workers were doing monthly visitation with the families, but over a period of time, the child and the family lost that connection with one another. So we were in court at the permanency hearing saying we need an additional 6 months, because now this child really doesn't know his mom as well as we want him to know. And mom has been out of the practice of meeting this child's needs on a daily basis. So we said, how can we make sure that we have weekly visitation? And so that meant looking at what our community had to offer and how we could come up with what we have now developed, the Safe Harbor Visitation Centers, so that parents can visit as often as they need to visit. And so this tool gives the parent everything that they need. The CSB stepped up in a major way with the development of this tool, because another barrier was that we were saying, well, we really don't know exactly what mom needs. And so the CSB said, well, we will do parent capacities evaluations for you. Now, we had been doing that, but it was taking quite a while to get the results of that evaluation back. And so when the CSB stepped up to the plate, they agreed to step up with the timelines that we wanted these assessments back. And so they have done that, and the CSB has really done a number of things to support that pathway to permanency tool. So it is accountability on the part of the parent, but it is also accountability on the part of the social worker, because at the end of every month, a form goes in a file that shows who has done what needed to be done, and if nothing has been done, still form goes in. So when the judge is hearing that case, he is able then to open that document and see just where the problems lie. And so it really has helped us to reunite children safely with their parents in a much shorter time frame.
And just to add to what Wanda said, when we're just finalizing an actual publication, a guide of sorts to the Hampton approach, it captures in a little more depth all of the issues covered in this presentation. And in the end, one of the appendices includes a sort of blank template of the Pathway to Permanency tool, so that people will be able to see how the process unfolds.
How about a round of applause for all these folks? Thank you all so much. And